So I want to welcome everybody to the Washington County Thrives quarterly gathering. It's good to see you all. And as is our tradition, we typically put our name and pronouns and organization, if we have an affiliation, in the chat room, in part so that we've got record of who was here, other than taking screenshots of our faces right now, our profiles. And if you want to add your contact information, feel free to do that. I am going to share my screen once again. We will have our next quarterly gathering on July 20th. And the big question is, are we going to meet in real life? Will we have an in-person gathering? I'm hoping. I'll probably send out a poll to folks just to cover my bases, but I think we will look forward to seeing each other, fingers crossed, in person on July 20th. And our agenda for today, we usually start with lightning rounds. So for those of you who are interested in sharing some information that you think is going to be of interest to this audience, you are welcome to do that in the beginning here before we get into the main parts of our gathering today. And one of those is we're going to have a little bit of information from our guest who is presenting on a May ballot initiative that we wanted to keep you informed on before we move into a proposed new initiative that I'm hoping our Thrive stakeholders will embrace. So with that, as far as our lightning rounds go, what I'm going to suggest is that if you have something, since we've got quite a few people in the room, but if you have something you'd like to share, use your raise hand button, or if you can't find that, you can certainly wave to me or just unmute yourself and say you'd like to speak. And then once you've been called upon, you can identify yourself and share what you have to share. So let's queue people up. Okay, I see a couple of hands raised. Julie, please feel free. Welcome.
Thanks. Good morning, everybody. I'm Julie Titus. I'm at Virginia Garcia Memorial Health Center and Foundation. And there's been a lot going on, but something I wanted to share with you guys is that tomorrow we're having our healthcare symposium. Y'all are invited. I'll put the link in the chat in just a moment here. We're going to be having a conversation about what's next in healthcare and how collaborations between community health centers like ours and public health entities are really critical to making sure that there's access to equitable healthcare for everybody. And we're going to have our keynote speaker is Dr. Bashara Shokir, who is the Chief Health Officer for Kaiser Permanente nationally, but he spent about a year as the National Vaccinations Coordinator for the White House. So we're very excited about that. It's tomorrow from 11:30 to 12:30. So hope to see you guys there, and glad to see you all here this morning.
Thanks, Julie. Rachel Duke, step on up.
I have an announcement that next week on April 27th, we have our annual fundraiser virtually, and I'll put the link in the chat. It's really fun. Tickets are free. Hear what we're up to. We've been really busy. And it's just a fun way also for us to share kind of what we're working on in the community. So there's that. And just, I guess, happy also to say, I feel like there's so many good things going on, and I'm excited that SEPA and a lot of the people in this room, we're getting to partner on them. So woohoo, go team.
Thanks, Rachel. Stephanie.
Good morning, everyone. I am with Washington County Cooperative Library Services. Just a couple of things of interest that we're working on. We've expanded our mini libraries program beyond servicing folks that are in shelters. We also now are providing little mini libraries in the Boys and Girls Aid locations in Washington County. The other thing we've been really kind of working on trying to figure out how we can do a better job of serving new refugees in Washington County. So we're talking with our member libraries and trying to find out what the real needs are and do what we can to support those folks. And then last, I just wanted to make an announcement that I am retiring at the end of the month. I plan to stay active in the community as individual. And then I also wanted to say that there still will be Washington County Cooperative Library Services representation here in this gathering. Our manager, Lisa Tattersall, will step in and be attending these meetings. So that's going to be fabulous. I'm happy for all of you to get to know her better and continue our work together. Thank you.
Thanks so much, Stephanie. It's been a pleasure having you and knowing you these last 7 years. Yeah, it's been that long for us. Kemp.
Geez, I have to follow Stephanie. Good morning, everybody. I'm Kemp Shuey, Executive Director at Community Action. And just a couple notes. One, I am planning to be, I'll be at the symposium tomorrow. I'm planning to attend, and I've got CPAW's event on my calendar next week. So I hope you all follow suit and find time to do that. And I will make a plug for our own organization. Community Action is having our annual fundraiser Kaleidoscope this Friday. So if you haven't already considered joining us for that, I'll put our link in the chat. It's a virtual event. This is the third time we're doing a virtual event. So it is also free to attend. And I will say, if you haven't attended a virtual event for any of our nonprofit partners, I really encourage you to do so. Even if you don't plan to give, it is a great way to get a deeper understanding of the work that we do. I know that's kind of the purpose of this collaborative, which is great. And then it's a great way to understand the stories and the impact that we're all having in our own respective ways. So please RSVP for all of our stuff. The one big thing I wanted to share with the group today was on the news on rent assistance. As many of you know, we've been at Community Action on the front line distributing assistance throughout the county over the last 2.5 years. And so there was a press release that went out on Monday from Washington County just announcing that the rent assistance, emergency rent assistance program that is being funded by federal dollars by the US Treasury is going to be closing on May 6th. So this is really an announcement that's specific to a certain funding stream that's closing.
Are you okay?
So I think the important thing to know is that we are continuing to deliver rent assistance through the funds that we do have available to us. It is going to require us to kind of narrow kind of how we prioritize who we're able to serve. So we're updating our website as quickly as possible to make sure that's clear. So that's kind of a developing process. So we'll have more information soon. So, you know, as of May 7th, we're still hoping to be able to accept applications, but it's probably going to be a narrower kind of criteria or eligibility criteria, focusing on the highest need populations. So it won't be quite as broad as it has been over the past 2.5 years. So that's an important thing to get out there, because the you know, folks who are still applying for assistance, if you have an application in, you do have tenant protections that will kind of cover you through at least September. So we are still here and we're still providing that resource and service, but it will be less. So we're hopeful there might be more resources coming, but we're not sure how much or when or if. So we're still waiting on that.
Thanks so much, Kemp. I also want to recognize Kemp as chair of Vision Action Network, so he plays a dual role here in this room. Peter, welcome.
Hi, I'm Peter Leonard, Executive Director of Cedar Mill and Bethany Community Libraries. And our libraries are up and running. We're open 7 days a week. We're resuming in-person story times. We have a lot of other activities coming up. During the summer, we are really putting a big push on for summer reading because one of the issues over the last 2 years in the pandemic is in order for kids to be successful in school, they need to enjoy reading. So we're going to put a real big push on that for kids and teens and adults. And I do just want to thank you for convening this particular discussion because behavioral problems are definitely on the rise all across our county, and we see them on a very regular basis in both of our libraries. So it's a real issue to work on collaboratively. It's not just a behavioral provider, behavioral services provider, or law enforcement, but it really is something that all of us can work together on. So thanks for convening this.
Thank you, Peter. Katie.
Hi, I just wanted to let everybody know about what Washington County Kids is sponsoring May 4th, which is a expo summer care fair. So there will be providers and talking about the programs that they're offering. There will be information about all the details, including the hours they operate, costs, all of these issues, plus an opportunity for attendees to ask questions. So it's a great opportunity for parents, guardians, caregivers to be involved. As we know, summer programs really make a difference in terms of kids' academic success and their future. So we are having information about how parents can sign up to attend. It's virtual, so it's all easy for them to sign up through Eventbrite. That information has been put out to newspapers and flyers to all the schools, but we appreciate it if you would pass it along to any parents that you know. And as was mentioned earlier, I think this convening is very important because in childcare, there is a crisis also in terms of being able to have enough staff, which means that there are then difficulties in being able to serve all of the kids who need to be served. Anyway, hope everybody has a great day. Thank you.
Thank you, Katie. And if you have any, if you want to share anything in the chat, a link to the event, you are welcome to do that. Allison, welcome.
My name is Allison Ikea, and this is my first time in the meeting. I work as the admissions and outreach coordinator for Portland Youth Builders. We're really excited to have a paid construction training program in Washington County that's fairly newer and a little bit underutilized. And so we are super excited this time to be able to offer an even bigger incentive. So it's a paid 9-week training, and it's up to $500 a week, kind of based on involvements Tuesday through Friday. So it ends up being almost minimum wage to do this training, and we help place people afterwards in apprenticeships, union apprenticeships, and other jobs in the trades. So it's really about getting low-income folks the skills and the support that they need to move out of poverty and into living wage jobs. So that's me. Our next cohort starts in May, on May 31st. We're actively, enrolling folks as we speak, and would be super grateful if you pass the information along to anyone that you feel like would be a good fit or a good referral partner. And I will put the flyer in the chat as well. So thank you so much.
Thank you, Allison. As always, there's plenty going on. I'm appreciative of those who wanted to share announcements. Is there anyone else before we continue on? All right. I'm going to launch a poll. I just want to get a sense. We've done this before. Because we are a cross-sector convener, it is always interesting to see who's in the room. So please feel free to respond to this poll. And I know sometimes it's hard to pick one, but pick the primary sector that you represent here today. All right. So I'm going to share our results here. We've got a wide spread, which is as expected, from workforce to faith, and healthcare, housing, social services. Wonderful. I'd like to also, Allison mentioned this was her first time. I want to see what your relationship is with Washington County Thrives. How long have you been engaged with Thrives, to the best of your memory? Oh, wow. Very cool. Now, let me share this. Over a third of the people are new to Thrives, which is great. And then there are people, 1 out of 8 has been around for roughly 10 years or more. For those who don't know, Thrives has been going since the recession of 2008. It wasn't formally called Washington County Thrives till about 2012, but it's a long-standing stakeholder group. All right, thank you all. So let me move on to our next agenda item, which is to give you just a brief overview of a ballot initiative that you will be seeing this Monday. And we have a guest with us, Jamie Dunphy. Jamie, I'm going to give you the floor and let you have a few minutes to share with the group what you want to say.
Awesome. Thank you so much. Can you all hear me all right?
Yeah.
Okay,
Gotcha.
perfect. Well, good morning. Hi. Thanks for allowing me the opportunity to speak with you all this morning. I'm here on behalf of the No on 34-314 campaign. My name is Jamie Dunphy. I'm with the American Cancer Society Cancer Action Network. We are the nonprofit, nonpartisan advocacy arm of the American Cancer Society. And I'm specifically here this morning to try and help explain some basic facts about what's happening on 34-314, why we are hoping that you all will vote no on it, and possibly how you can help. I also want to say that my last presentation was to the Washington County Chamber of Commerce. So it's a really nice change of pace to be meeting with folks like you all. It's a lot nice. It's nice to be in a room full of like-minded folks. So I wanted to start this morning by explaining some very basic facts about why the Washington County Commissioners chose to end the sale of all flavored tobacco products. These are some basic facts about how Big Tobacco and their sympathizers intentionally target children in their effort to create a new generation of smokers who are stuck with a lifetime of addiction, illness, and death. Just for context, in November of this year, Washington County, I'm sorry, of last year, it's 2022. In November of 2021, Washington County Commissioners voted affirmatively to end the sale of all flavored tobacco products in Washington County. This is traditional tobacco as well as e-cigarettes, chew, any of the really harmful tobacco products that are available. Washington County Commissioners were the first in the state to choose to voluntarily end the sale of these. And there's a lot of really good reasons for that. First and foremost, flavors are added to tobacco products, including e-cigarettes, to make them taste good. It's obvious. Flavors overcome the harshness of cigarette smoke and the unpalatable taste of straight nicotine vapor. And by masking the flavors, it makes it more approachable for first-time users to be introduced to these products. They make them taste things like cookie dough, cotton candy, mint, breakfast cereal, churros, and fruit. And a lot of these flavors are sold in vape shops that already have an age restriction for entry. But the most common flavor of e-cigarette among youth is also the most common flavor of flavored tobacco, menthol, the exact same kind sold in every local convenience store. Now, e-cigarettes are not a healthy alternative to traditional cigarettes. There's exponentially more nicotine and addictive substances in one vape pod than there is in an entire pack of cigarettes. These chemicals have incredibly damaging effects on developing brains. And the science is extremely clear that vapes are not simply harmless water vapor alternatives to smoking. That's a marketing decision made by big tobacco and not anything based in science. Now we find ourselves at this spot because the local convenience store Plaid Pantry actually funded the effort to repeal this ban. There are some basic facts about the tobacco industry that even folks like Plaid Pantry don't dispute though. 95% of adults who smoke started before they could legally purchase their own tobacco products. 88% of youth who use an e-cigarette report that they started with a flavored product, and 85% of those same youth continue to exclusively use flavored products. Now, market data shows us that adults don't really use these flavored products. Only 25% of adults who smoke report using any kind of flavored product. The last statistic I'm going to give you, 78.5% of youth who use e-cigarettes report that they don't buy them themselves, but instead they get them from friends and family members. So that's not to say that some of these convenience stores aren't selling directly to children. In fact, my 16-year-old nephew helped me get a Plaid Pantry, an AM, PM, and a Shell station in trouble for regularly selling to underage customers in Beaverton off Murray Road. For decades, organizations like mine have been approaching tobacco control from multiple directions, and banning flavored tobacco products is just one component of our strategy to try and reduce the burden of tobacco-related illness on our community. In 2019, Congress followed Oregon's lead and raised the national age to purchase tobacco to 21. In 2020, Oregonians approved Measure 108, increasing the tobacco tax and creating the first tax on e-cigarettes in Oregon, which nearly tripled the amount of money that is going into the state's Tobacco Prevention and Education Fund. And in fact, this year, Oregon was the number one state in the country for tobacco prevention and education funding. In 2021, the state legislature passed the first statewide tobacco retail license, finally requiring stores who want to sell tobacco to have to apply for a license. And the state and federal government both passed laws preventing the sale of e-cigarettes over the internet and shipping across state lines. Yet, youth e-cigarette use has reached an epidemic level to the point where even since students have returned to class following COVID-19 restrictions, high schools in Washington County have had to remove the doors from bathroom stalls to try and prevent teenagers from vaping between classes. Go ask any teenager and it's true. Lastly, as anyone who has worked in the state of Oregon knows, cities and counties are incubators for good ideas. Washington County was the first jurisdiction in Oregon to pursue a policy of ending the sale of flavored tobacco products. But we joined over 300 local jurisdictions and 9 US states that have already implemented policies similar to this. And now we have enough data to conclusively show that in states where they have banned the sale of flavored products, sales and youth consumption both dramatically decline, but convenience stores continue to operate. There's an argument that we've heard that by banning it in the county, we simply shift business to other jurisdictions. But we have evidence to clearly show there's a correlation between youth consumption and local availability. Teenagers will not go to the neighboring county, and their friends and family members who purchase products for them will not make the extra drive. But banning flavored products will inspire neighboring jurisdictions to follow your lead. We know for certain that Multnomah County and others are actively considering how to follow your lead, as is the state legislature. So if I had my way, I would ban tobacco in the state tomorrow. It's an unbelievably deadly unbelievably deadly product. In fact, tobacco-related illness continues to be the #1 cause of preventable death in Oregon, higher than the next 6 causes: car crashes, firearms, alcohol, all illicit drug use, obesity, and the flu combined. And tobacco use costs Washington County almost $400 million per year in direct medical costs and lost productivity. But we're not talking about banning tobacco outright. We are only talking about banning the flavored products that are explicitly used to trick children into a lifetime of addiction. Tobacco products will still be available in Washington County. One would still regrettably be able to buy a pack of Marlboros or an unflavored e-cigarette. But we should not be rewarding bad actors like the tobacco industry and their sympathizers by letting them to continue to shamelessly target children with their addictive products. Washington County has an opportunity to send a loud statement of our collective values, that big tobacco has no role in our community anymore, and that the predation of our children is no longer acceptable. And we can prevent a new generation of smokers from ever starting. So my request to you this morning is twofold. First, please make sure your friends and family in Washington County vote no on 34-314. Second, if this is something you support, please consider following us on social media channels and sharing the word through any of those channels possible. I know that many of the folks on this call are government employees, or it's not proper for you to weigh in on something like this, but in your personal lives, we need all your help that we can get. We need to send a very clear message to big tobacco, and Washington County is blazing the trail that others follow. Thank you for letting me present our argument this morning, and I'd be happy to take any questions or concerns you might have. Carol, there's a question in the chat from Carol here. It's asked if I have literature that we could hand to canvassers on a door-to-door. Absolutely, yes. We have actually a paid field operation with 35,000 hand flyers ready to go and boxes of them. So if that is something that folks are already out on the street and are looking to help carry, I would love to help coordinate and make that happen.
Thank you, Jamie. I just want to go on record by saying that while Van's board has not taken a position on this, it's unusual for us to assert ourselves in policy discussions. This was an issue that enough Thrive stakeholders cared about that it seemed appropriate that we include Jamie and share the information that he has. So thanks for being here, Jamie. And you're welcome to stay as long as you like. But if you need to check out, feel free.
Thank you. I'll leave one last plug in the chat. I'll leave a link to our website and our social media if anybody's interested in following us on Facebook.
Great. Thanks so much.
Thank you all. And I'll also leave my email in case anybody wants to chat. Thank you very much.
So moving on, friends, I want to share a little bit about what Van has been involved in regarding behavioral health and to get your feedback on some steps that we're taking and perhaps doing some weaving together of this particular initiative with our Washington County Thrives stakeholder group. We held a workforce summit for behavioral health care providers and many other stakeholders. We had about 90 people who represented many of the sectors that are present here today. And we were talking about the crisis that the behavioral health sector is in, only made worse by the pandemic. But more than that, it was an opportunity to gather folks and to consider creative ways in which we might respond to this crisis and how the community could come together to help improve the lives of both workers and the people they are serving. And after the summit, Jenny, my colleague Jenny, took these ideas that came about and synthesized them and distilled them into a number of focus areas. And we will be sharing that information with you after this meeting. You'll get a follow-up email. But essentially, we came up with 4 main focus areas that we consider important ones to take action on. One is obviously the workforce development piece of this problem. There are many, many shortages in the field. There are people who are severely overburdened with workloads. Folks have exited the workforce, not only because of the pandemic, but just the stress within the industry. And so one of the areas is to find ways to breathe new life into this sector and encourage people to be a part of this workforce. A second focus area is just the immediate care for clients and workers alike. We had a meeting yesterday with about a dozen or so providers and key partners as a follow-up to the summit. And Mary Monnet, the CEO of LikeForks, shared just a devastating story about a young woman who took her life 2 weeks after the mother had called Mary and pleaded to find support for her. They could not get her in to see anyone. And within 2 weeks, she was gone. And so it's both a personal and professional issue. And so the immediate care piece is one that we feel deserves an incredible amount of attention. The third focus area, and this was already alluded to by Katie, in terms of our crisis when it comes to taking care of our children, our young kids that are not even old enough to go to school, as well as our youth and young adults. And it is a cross-cutting issue within the behavioral health care, not only the workforce, the challenges that people have taking care of their own children and being able to work, but also the clients themselves who it's an added stress. It's one of those contributing factors to their own health and well-being that they're not able to get adequate care for their children. They may not be able to work because of that, or they just may be concerned that their kids aren't getting the right care while they are away. And finally, the fourth area of focus is just to raise awareness. Just as we had Jamie talking about the issue around tobacco use for kids, even though people are experiencing this crisis in different ways, there still seems to be a lack of knowledge about the real nature of the crisis. So trying to get public support, doing some outreach, disseminating information, but also providing some source of hope that there are ways in which we can address this crisis. So those are the areas that we have talked about that were raised during the summit, that we kind of reflected back to folks after the summit and are beginning to look at concrete steps that we can take in these areas. And finally, while not a focus area, one of the topics that came up in our small group breakouts during the summit was that we also have to use an equity lens and racialize some of the issues regarding behavioral health. We had Jonathan Collin, who is the director of Centro de Prosperidad, and they do workforce training and work primarily with the Latino community in Washington County. And Jonathan was there to talk about some of the particular challenges that folks who, that the BIPOC community has in terms of being both members of the workforce and the issues that they're addressing, but also clients who are needing services. So thinking about how we approach these problems through an equity lens is going to be important. So I'm going to pause there for a moment. I'm going to see if anyone has any comments. I know there were some folks in the room here today that were part of the summit, but if anyone has questions or comments, I want to invite those at this time. And feel free to chime in. Since I'm sharing my screen, I can't see everyone, so. All right. So what I am proposing is that because of the overlap with Thrives, I mean, there's clearly our priority areas. For those of you who are not familiar with what we have been focused on with Thrives, there are three priority areas. One is affordable housing and the wraparound services that are necessary to keep people in safe and affordable housing. The second is workforce training. And the third is early learning and youth enrichment. So you can tell the wraparound services, the workforce training, the early learning are all intersecting priorities with what we came up with in the Behavioral Health Workforce Summit. And so in my mind, this is a perfect marriage and one in which we can fold this particular initiative under the auspices of Thrives and engage a broader stakeholder group and use this established forum that we have to take some concerted actions in these focus areas. So there is a sign-up sheet that we have created, and I will copy that link and I'll put it in the chat for you if you want to bookmark that or get on it as soon as we get off this call. We're basically asking people to let us know, where do you want to be involved? And we are going to begin a concerted effort to organize actions in these focus areas. Van is, thankfully, we have an opportunity to tap some ARPA funds. The county is looking at ARPA funds that are appropriate for this particular initiative to support the continued convening and the herding of the cats and the coordination and the connecting of the dots, etc. And we're also looking at a foundation that has reached out to us, expressed interest in this particular initiative. And we know that there's probably going to be additional resources necessary as we're identifying new ways of approaching these problems. We may not have the capacity or the tools or the programs, and there may need to be funding to help create those. So Van will be working with stakeholders to do some of that resource development as well. Bruce, I see your hand up. Please feel free to ask your question.
Yeah, I am unmuted. Okay, so the youth development aspect of it makes me think of the Extension Service 4-H program, and I've connected Washington County Juvenile Services with 4-H, and I just wanted to put in a suggestion that reaching out to that well-established 4-H organization would probably yield some good fruit in the youth development, as well as the Juntos program that Extension offers, which supports Latino youth. Both of those seem like really good allies to include in this.
Excellent. Thank you, Bruce. Appreciate that.
And I could provide contact points if you would like.
Yeah, I would love it. You can either email those or put them in the chat, whatever you think is appropriate. I have just included in the chat the link that you see here for the sign-up list. If you want to get information, I'm not asking for a commitment, a hard and fast commitment from folks. I'm just trying to get people's interest. You'll be invited to participate, and if you can, wonderful. If not, that's quite all right as well. And then the notes from the summit, the synthesization of the ideas, I just put that link in the chat as well. Other questions or thoughts? Do folks see this as a worthy endeavor for Thrives to embrace? I see a thumbs up from Kemp.
It reminds me of this reminds me of is the role Thrives has been involved in past efforts around affordable housing, and so and we knew that that's a major issue that needed focused attention and support, and the result has been really important funding both in services and production of affordable housing, which is great. And so I think Thrives and this group had an impact on that, and I think we're seeing the same need. And for community action, we touch in a lot of these spaces too, so these are needs we see, and so I think this may be a very logical opportunity for Van to be involved in, so I'd like to see that.
Thanks, Kim. Yeah, we spent a good 5 years focused on affordable housing, and now that we have an affordable housing bond and the housing services measure, there are resources and actions taking place. A lot of our stakeholders here in the room are owed credit for the work that they're doing in that area. And we have been slowly kind of shifting and looking at, well, what are we doing in the workforce training? What are we doing in the early learning and youth enrichment areas? This obviously gives us an opportunity to spend more time and concerted effort in those areas. Bruce, did you have something else you wanted to add?
Yeah, I wanted to mention something that has been on my mind, which is we talk about mental health and mental health issues, but I don't think that the general population has a functioning understanding of what mental health is. And so if there were a campaign to educate people on how do you know if you have what is mental health, and how do you know if you or another person in your life has a mental health issue, it would go a long way towards sensitizing people to supporting the providers. Because I think a lot of people just suffer in silence without realizing that there is an actionable condition that they have that could be addressed.
Yeah.
So what is mental health? How do you know if you are mentally healthy or not? Which kind of gets a little subjective, but
no, that makes good sense, Bruce. Just the awareness and the understanding of our own experience of maybe struggling with mental health or addiction issues also creates empathy.
Yeah.
That we can use to serve others. Thank you. Alisa, welcome.
I was just wondering if you have reached out or thought about reaching out to PSU School of Social Work or any of the graduate programs in psychology to get their perspective on what's happening on the student recruitment end and, just their students' experiences as they're looking for jobs.
Yeah, that's a good point. And it is one that we, at the summit, we had a number of representatives from Pacific University. We had folks from PCC. We had Hillsborough School District, Forest Grove School District, Tigard-Tualatin School District. So education was well represented in the summit and wants to be engaged in this and wants to figure out how they can tie their students in, both from an internship standpoint, a research standpoint. So yes, and then there was conversation yesterday about, I think it was about psychology majors being like dead last in terms of marketability for jobs or something to that effect. Am I right, Jenny and Allie, who were there? Yeah. It's not a pretty picture for folks who want to get into that field. There doesn't seem to be a lot of support in the marketplace to help them pursue a career. So yeah, there's a lot of work. We have no naive notion that within a few months we're going to actually turn this ship around. And as you know, when Van gets involved in any particular initiative, it is typically a deep dive. There's going to be a long-term process of making sure we've got the right people at the table, thoughtfully approaching these issues. I mean, we've got folks who were in the room yesterday who, want immediate action now because they're in the sector. They're running organizations that are doing this work. They're desperate for solutions. And yes, we need to take immediate action, and we need to balance that with a thoughtful approach that's going to try to change some systems that are going to make it easier for them to sustain their workforce over time. So it's a both and type of situation. But yes, Alyssa, thank you for bringing in the students. Other questions or thoughts?
I'll just share that absolutely this is a really critical issue in our community and something we're seeing, very a lot of the impacts from workforce issues and childcare and all of these things that you mentioned here at Virginia Garcia. And so, yeah, very excited to have a broader collaboration on finding some solutions.
Great. I hope we will have your folks involved. Anyone else?
So I wanted to add another thought on this too. I
Sure.
think it's not just a matter of finding more people to be doing the work. I think there needs to be an examination of how the work is done. And sometimes that means looking at some innovative ways of doing things. In the past, I was involved in a research project where we took a look at how people could get behavioral health treatment faster and keep at it longer. It was actually a process improvement kind of approach, and where they would have a walk-in clinic ability so that people could be seen immediately. It doesn't necessarily mean that then they were involved in long-term treatment, but it could be triaged very rapidly. I'm just mentioning that as another approach to the behavioral health staffing crisis. And like also people are doing more with telehealth. It's not just here, but also in other countries where they were doing counseling via Zoom or whatever, and that was pretty effective too, and increased the ability to care for more people.
Those are great points, Katie, and those are issues that were raised as well during the summit, and I know that they're going to get folded into this broader conversation. But thank you for highlighting them. Good morning, Bridgette.
Good morning. Good morning, everyone. Hey, after listening to Katie, I thought I should jump in here as well. So yes, I'm so glad to see Vision Thrive's taking on this issue, and seeing all these people in the room. I know it's been an issue that we have seen increasingly impact our families at Adelante Mujeres. Didn't introduce myself, but I'm Bridgette Cook, Executive Director and Co-founder of Adelante Mujeres, based in Forest Grove. And the behavioral health needs that we're seeing within our youth and our Chicas youth development programming and our early childhood education programming, as well as in our adult ed programming. And we've identified that probably the most significant barrier in impeding our participants' progress, whether that is starting a small business that they've been dreaming about, or getting their GED, or just kids staying healthy and in school, it really does come back to behavioral health, to mental health issues. So we have been, over the past year, sort of studying this issue from a culturally responsive lens, and are seeing, there's so many challenges for the workforce, but part of those challenges have to do with just being so overworked, right? So as part of our research, we're having conversations with providers, what they're doing to try and keep their staff, to retain their staff. And those who go into this work do so because they have a heart for it. And this is, oftentimes this is where they want to be, but they're finding the workload is so intense that they're moving out and either leaving it completely or moving into private practice, which then they're not serving the community that that they initially wanted to reach. So we were just had a fascinating conversation with Albert Paramon, I think is his name, who directs Puentes, which is the mental health, behavioral health services for Central City Concerns in Portland. They've been around for 10 years. And he said one of the things that they've done is reduce the caseload from, maybe 7 or 10 clients a day to that no more than 50% of a provider's schedule can be dedicated to, or would be actually seeing clients, because it's so exhausting. And that 50% is, I guess it's 65 or 75, he says, is the more typical caseload. And some of you would know that better than I do. But love seeing and hearing what they're doing. And we know some of the providers that work at Puentes, and they feel like, wow, it's just such a fresh air to be in an environment that is really respecting them as professionals and recognizing their own mental health needs as well as their clients. So it's we're in this year-long process to determine, whether we will move into the space as a culturally responsive mental health provider or not, because we certainly don't want to create greater problems for the workforce or greater difficulty for other providers to hire their workforce. But I think that perhaps the more of us who are involved in this, the stronger our message is about how reimbursement rates need to be changed, and how we all need to be standing up for the providers as well as for the community. So just happy to be part of the conversation. Thank you all.
Thanks very much, Bridgette. Carol.
Bridgette actually spoke to some of the things I was going to say. I've been trying to talk to people in the workforce, both in education and in behavioral health. And one of the things I consistently hear, and this is, I'm sure, no surprise, is so many jobs these days offer flexibility, and our behavioral health jobs, because of scheduling now, very rarely do. And I'm playing with ideas like letting people have some control over how much they work a week, their schedule, and also looking at sabbaticals, perhaps. An additional thing that I think is an incentive that I'm surprised people don't know is the idea that if you work for a nonprofit for 10 years, you have your student loan forgiven. And I don't think we talk about this enough with people. And I know a lot of people who are actually staying in very difficult jobs for 10 years because they know that's going to have a payoff at the end. So I think looking at, and I'm just really building on Bridgette in a way, looking at the ways that we can say, there's some real benefits in here in your ability to control your life as a provider that I think are very important.
Thank you for that, Carol. Other thoughts or questions? Well, it is never my intention to keep people in a meeting just because it's been scheduled to go until a certain time. I love being able to give you back some time in your day. And
hey, Glenn, this is Andrew.
Oh, go for it, Andrew.
Sorry, I think my hand was up, but I don't know. Hi, everyone. This has been great, and I really appreciate Thrive's taking leadership role in this. We have been doing a lot of work with OHA to try and figure out where some of the resources that they've received to actually invest in skilling up and expanding the number of mental health and behavioral health workers is. So we'll continue to work that channel and hopefully figure out some strategies to free up resources to address some of these issues, because there's considerable investments at the state level available to skill up the workforce. I think OHA is just trying to figure that out. And so Sabrina and some others on our team have been looking into that, and we'll keep people posted as we learn more. So thank you.
Thank you, Andrew. I was on the second screen of everyone. I couldn't see your hand raised. I apologize. Anyone else? Well, as I shared earlier, we are going to be doing a follow-up. You will, if you are on our Thrive's email list, you will get that information. For anyone who is new that has not gotten on the list, you can go to our website, visionactionnetwork.org. You can scroll down to the bottom and you'll see where it says, stay connected, I believe. You put your email address in, you click on the sign up, and I think it might even give you an option to choose just Thrive's versus Van's kind of global email list where we have our monthly newsletter. I would encourage you to sign up for both because we oftentimes have other information outside of Thrives that may be of interest to you. But we will be moving forward on these issues, trying to piece together the resources we need, the people we need at the table. Know that this is going to be something that we will revisit at our quarterly gatherings, just as we have always kind of left room for our housing and supportive services topic, because that is an important initiative. We will give updates and create opportunities for people to connect and engage at each of our quarterly gatherings. So July 20th will be the next time that we meet as a Thrives collaborative, but I'm hoping that I will see many of you over the next few months as we start forming, storming, and norming on this behavioral health initiative. That's all I have for today. If there's anyone who didn't get a chance to share an announcement during our lightning round, if you have something that you would like to share now, you are welcome to do that. Feel free to raise your hand and step up to the microphone. Debbie, yes.
Oops, here I am.
Good morning, Debbie.
Good morning. I will hop in just to say it's Earth Month, Earth Week, and Earth Day on Friday. And I believe in talking about the earth we live on and our relationship to it, as well as the relationships among ourselves. So I'm with 350.org Grassroots Climate Action in Washington County. And we have several events coming up. On Friday, Earth Day proper, we have a 9 to 10 a.m. sign waving event in downtown Hillsborough at First and Main. Signs will be provided. It's a great arena for chat on what's current in the county about climate action and where we need to be going. So that's Friday morning from 9 to 10. And then we're very excited to be tabling, what a concept, at the opening farmers market on Saturday in downtown Hillsborough from 9 to 1. We have plant seedlings to give away to kids and kids activities, and ready to have a chat about any priorities that you care about that we know, or that you might know that we don't. And then we have a partnership with Solve for a big trash cleanup on Saturday, the 30th of April. So these are our actions in honor of the earth, and everyone is welcome to join us.
Wonderful. Thank you, Debbie.
Thanks.
Marcia.
You can find out more on our Facebook page.
Great. Go ahead, Marcia.
Members, I just wanted to thank Ben and everyone who's chimed in today and who's participating in the work groups for your focus on behavioral health. The issues that we're dealing with have been around for a very long time and been exacerbated by the pandemic. But they've been there for a long time. And so now to have the focus and the energy directed toward meeting these needs is just so exciting. And I'm so appreciative of it. So I just wanted to say thanks.
Well, I appreciate you, Marcia, and your team. Thank you. Kimberly.
Hi, I'm Kimberly Culbertson. I'm one of the board members of Habitat for Humanity Portland region. We have finished our merger, and so we are covering almost 3 counties now. Yeah, and I wanted to, just make sure y'all knew we have our Hope Builder lunch. It doesn't cost anything to attend, but it is very heartwarming about how people's lives are literally changed by the opportunity to have their own home. We have Soledad O'Brien as our keynote speaker this year, and she's wonderful. So I dropped the link to the invitation in the chat, but just feel free to come and check us out. It's a great way to spend a lunchtime, and it's virtual too. You don't have to eat rubber chicken. So that's all for me. Thanks.
Thanks so much. Appreciate that, Kimberly. Anyone else? All right, friends. Good to see you all. I see that Jenny put a link to our sign up and the forms to express your interest in the focus areas on behavioral health, I believe. So I'll leave this room open just for a little bit because there were a lot of links and a lot of information shared. So if you haven't had a chance to copy those things, feel free. But you are all free to go. I appreciate you all very much. Hope your week goes well. Happy Earth Day. Happy Earth Year. And take good care.
Thanks, Glenn.
Thanks, everybody.
Thank you. Bye all.